Maryland right now has a senior housing crisis. We do not have enough senior housing options, especially for low income.
So we, I think, fully recognize the challenges and complexities of this.
For months, Spotlight on Maryland has investigated allegations of senior trafficking of vulnerable adults through suspected unlicensed assisted living facilities. In 2023, multiple state agencies lobbied lawmakers to toughen penalties, resulting in a law making it a felony to operate an unlicensed facility when abuse or neglect occurs.
History has shown that some predatory unlicensed assisted living facility operators will never and should never be licensed. Their facilities are deplorable and their services do more harm than good.
Governor Wes Moore signed that unanimous bipartisan bill into law. But at a recent House Health Committee hearing in Annapolis, the message about unlicensed senior care shifted.
You know, it's hard to say this, but it's true. Just because you are unlicensed doesn't mean you are providing bad care. Some people just don't know that they are supposed to be licensed because they're caring for 2 or 3 people.
Rather than calling for criminal enforcement, Dana Kaufman, Lifespan Network's lobbyists, urged lawmakers to engage unlicensed operators, not prosecute them.
What we've heard before is a lot about enforcement, but I think that this enforcement issue also gives us a very good opportunity to step back and get a better understanding of how we got here.
For the past 3 months, Governor Moore's administration has echoed the lobbyist talking points, prioritizing working with unlicensed assisted living facility operators to achieve compliance. This approach was outlined by David Turner, the governor's senior advisor and communications director, in December.
When the complaint is investigated, they work with the facility to come into compliance. There could be fines. But if I could finish, Gary.
Turner's message was echoed a month earlier in November by Dr. Meg Sullivan, Maryland Health's deputy secretary.
The authority is, and what we do is to investigate the complaint, determine if there's kind of immediate action, and then work through the process. This may include issuing notices of violation. This may include issuing citations, fines, working with the facility to become licensed, or taking appropriate action.
These responses raise a key question. If operating an unlicensed assisted living facility is a felony under certain circumstances, why is the state prioritizing assistance over prosecution? Still further, what is the state really doing to stop senior trafficking?
Creating this work group through the Department of Aging and the Maryland Department of Health about the broader issue of senior care and the need to increase demand to meet, or increase supply to meet that demand.
Governor Moore's senior advisor said a new interagency work group was ordered by the state's chief executive to address the issue.
On January 27th, MDH, in collaboration with our partners at the Department of Aging, launched because it's ongoing, an interagency work group on unlicensed assisted living programs.
Maryland Health's Dr. Sullivan said her team recently launched a work group on unlicensed care facilities. But public records we obtained show a similar work group was created in 2023 after the felony law was passed. Meanwhile, campaign finance records show more than $7,000 in contributions have been made to Governor Moore's reelection bid from a Lifespan Network's board member and his political action committee. This does not account for the more than 500 senior care providers Lifespan represents statewide.
Over the past several months, we have taken several steps to strengthen our facility oversight functions.
I just want to respond medical on 20-70.
As the state discusses supply and demand, our investigation documents we obtained show repeated 911 calls to more than 115 suspected unlicensed homes, many quietly monitored by Baltimore with limited state intervention.
Garrison Boulevard, an injury from a fall, 69-year-old male, 17 Bravo 1 response.
Those obtained complaints filed with Maryland Health show an elderly man found under a bush in the rain, barely alive. Another covered in feces with a diaper in his mouth in a separate incident. In another case, a woman was left unable to walk after an untreated urinary tract infection.
The overarching theme that we see here in the state is building issues.
So we have recently launched a public-facing link on the OHCQ website to directly facilitate the reporting of suspected unlicensed facilities, recognizing, though, that a website is not the only way that people may report.
The health department says it has strengthened oversight and launched a public reporting portal for unlicensed facilities. That portal went live after our months-long investigation resulted in at least one emergency suspension notice against an operator allegedly providing services without the appropriate license. Maryland Health and the Moore administration continues to leave us with more questions than answers. We will continue to investigate. In Annapolis, I'm Gary Collins with Spotlight on Maryland.
I'm Kai Jackson. Thank you for watching. Here's another video to watch. Also, please take a moment to subscribe to our channel.